Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. The 5 things that we're going to cover today are understanding hospital hierarchy, asking the right questions, understanding medical jargon, recognizing medical errors, and advocating for you or your loved one's wishes. So going in that order, hospital hierarchy. When your loved one is in the hospital, there are so many people who will be coming in and out of your room, and it can be hard to keep track of everybody, to know everybody's roles, and to know who to ask for certain things. So fortunately, nowadays in a lot of hospitals actually utilize a color-coded system. So for instance, the facility that I've worked at, and most of the facilities actually in our area, your registered nurses are in navy blue. Typically, whatever color coding system the hospital uses, they're going to have displayed somewhere. If it's not displayed in your room, simply ask your nurse for that information. But generally speaking, your nurses are going to be in one color. Your nurses' aides or techs or CNAs, you may hear them called, will be in another color. Food service is typically in their own color, and as is your cleaning service. Case management and social workers oftentimes are in like semi-casual or semi-professional street clothes, and your doctors, who knows what they're wearing. But they usually let you know when they're in the room that they are a doctor. So it's important to know who's in your room because if you ask for things from the wrong person, you're not going to be able to get the result that you want. So for instance, if your food service worker is in delivering your tray, but you ask about your pain medicine or going to the bathroom, that request is probably going to go unserved. Because more than likely they may try to catch somebody, but oftentimes, they have their job that they're focused on doing, and it'll kind of end up falling on deaf ears. Similarly, if physical therapy is in working with you and you need your pain medicine or to pee, again, it can kind of go, sometimes they will seek out the nurse. Other times it kind of falls off their to-do list with everything else that they're working on. So it's important to know who's in your room and who to ask for things. Typically, if you're not sure, your nurse or sometimes your nurse aide is a great place to start. Nurses are often kind of the gatekeepers of everything else. And if they're not the person, they know who the person is and how to get you there. That being said, if you know that your nurse is not the person you need and you do know who you need, go that direction, because I can tell you from experience, your nurse is getting pulled in 17 directions for each patient at one time. So the less you can put on their plate, the better they're going to be able to fulfill all your needs in general. So the second most important thing to keep in mind when you're in the hospital is asking the right questions. Bonus tip that goes along with this, if you have been hospitalized, or best case scenario, you have a hospital coming up and you can prepare and pack a bag, bring a notebook and writing utensils with you. Every time that any of your providers come in the room, whether it be the doctor, the nurse, the respiratory therapist, physical therapy, case management, what have you, take notes on what they're saying. Even better, if you can, to also record what they're saying. I would not advise that you do this without their permission. I don't know about you, but I know I don't like to be recorded and not be aware of that. But oftentimes they are agreeable to at least a voice recording, especially when you say that you want to have the information to be able to refer back to later. So make sure that when they are talking to you, either about a new diagnosis or just updating you on your care plan, that you are recording and or taking notes. This will make it easier when you go back and you're trying to figure out what did they say, or perhaps you know that there's something they're saying that you want to find out more about later, to have it all in one place. Also, so you can keep track of your hospital journey. When they are talking to you, unfortunately, our medical professional, particularly physicians, can get into a habit of speaking medical jargon. You know, your doctors have spent well over a decade training, and then most doctors you're interacting with also have years, if not decades, of experience, and that makes them an expert on their topic. That being said, when you are the expert in something, it can be difficult to take the 3 steps back and speak in plain language. They often will fall into using complicated medical terms that they forget are not common knowledge, or even abbreviations. That's the one that really gets me the most. How do you expect regular lay people, so to speak, to know abbreviations? I grew up with that firsthand. My parents were both in the Air Force, and I tell you, they would talk about conversations or have their buddies over, and they might as well have been speaking another language because it was all acronyms and other jargon. So I know exactly how off-putting and ostracizing that can be. In addition to, you're not getting the information that the doctor thinks they're relaying to you. So always feel empowered to stop them and ask them to put it in plain English whenever they're saying anything that you don't understand. Typically, they will be agreeable to that because, like I said, it's usually not intentional. If for some reason you do have a provider that is not agreeable to that, number one, that needs to go up the chain of command because that's not appropriate. You have the right to understand your medical information. Number two, while you are in the midst of dealing with that situation, this is why it's important to take particularly good notes so that at the very least you can take that complicated information and seek out, either going down the information rabbit hole on the internet, or seeking out perhaps some clarification from other members of your care team. This is one of the great reasons that it can be so key to have a professional advocate involved with your hospital care, particularly one who does have acute clinical experience, because we can be right there with you on the fly, not only to address the issues with the provider who's speaking to you that way, but then to also in real time be able to give you the understanding of what they're saying and the perspective of what it means for you. So I kind of blended asking the right questions and understanding medical jargon together. They do kind of go hand in hand. Another thing I want to say, though, with asking the right questions, it's also important that your care team is asking the right questions of you. Whenever they're going through something or talking about your history, or perhaps a medication that you've been on in the past, or talking about introducing a new medication. Anyways, anytime something comes up, please do not hesitate to volunteer information about your medical history or your allergies or a previous experience with something that seems to be related to what's going on now. Do not assume it's in my chart. I've heard this so often over the years, and while I get it, it makes sense. If it's in your chart, your medical team should be aware of it. Unfortunately, the amount of information that's in a medical chart and the way at which the information is presented, typically we can't find something unless we've gone looking for it. So if there's an incident, especially if it was at another healthcare facility that perhaps isn't on the same record system, if there was a prior incident or something related that is really imperative to what's going on with you now, the care team may not even have any knowledge that happened at all. So never assume that just because you think that it's been documented somewhere, or you talked to, especially if you just kind of talked casually about something with a doctor, like in an outpatient setting, that information is likely to be kind of buried in an obscure place. So always volunteer information about anything that could be related to what's going on with you now. It's in your best interest. In addition to when I was talking about the understanding medical jargon and taking recordings and notes, and if you can't get the best information from your provider, finding it out for yourself, I just want to mention some of the best places to go to on the internet for that would be WebMD, the National Institute of Health, Johns Hopkins, or Mayo Clinic. Those areas have the most up-to-date and accurate information. Please do not take it to forums. Perhaps there's Facebook group for everything. I personally love them. We're in one right now, and they can be very helpful for getting you steered in the right direction, or perhaps to finding the resources you need. But just be very wary and make sure you're not actually taking medical advice from those people on the other end of the phone or the conversation. I'm sure that they have the best interests. However, you do not know what their experience and qualifications are. So I just want to put that little disclaimer in there. So the fourth piece of staying safe in the hospital is recognizing medical errors. Now, this one is very complicated, and medical errors, unfortunately, are very commonplace. It's actually part of the driving mission of my goal here with Heard for Life, is that here in the US annually, we actually lose about 400,000 people a year due to preventable medical errors in the hospital, which, if you ask me, it's an outrageous number, and it's a very complicated process that unfortunately does not have one simple answer to how do we fix this. But I have to point out to you that with regard to your medical care and your journey going through the medical system, there is no one who is more invested in your health outcome than yourself. You cannot blindly rely on the doctors, nurses, respiratory therapists, and everybody else who's part of your care team. Their attention is always divided in multiple ways. There's shift changeover, and frankly, there's a lot of staffing issues. Therefore, that and many other things, even the best clinicians are not always able to function in their best capacity. And it's very easy for things to get missed through the cracks. This is, again, one of the reasons why it's so important to consider having a professional advocate as part of your care team, because that person is much more dedicated to you and doesn't have the turnover that your regular hospital care team has. That being said, it does ultimately fall to you to be the most proactive in your care, which, of course, is a very tall order when you're sick. It's always best if you can have a trusted friend or family member with you as much as in the hospital as possible. That's so helpful, because they can be the second set of eyes and ears. And at those times when you're really not feeling well and kind of out of it, be able to help pick up on situations and to help to advocate for your needs. So if there is a medical error, it's going to be, they don't all present the same way. It would be so nice if, we had a medical error and, a little one particular sign popped up and we could run at it and address it right away. But depending on what has happened, these things can be kind of sneaky. But in general, here are some things that you want to be on the lookout for. A sudden change in status. If you or your family member, loved one, was doing really well, and then all of a sudden, maybe you went down to the cafeteria to get some lunch, and you come back and they're really out of it when earlier they were holding a conversation with you, that would be alarming. Now, the caveat to this is that doesn't mean that there has been a medical error. There's unfortunately a lot of medical conditions that can warrant these sudden changes in status or a decline in a patient's medical condition. But it is just something to raise a flag and say, hey, pause, let's look into this and make sure we're not overlooking something, that there hasn't been some sort of error or something missing that needs to be addressed. In addition to the sudden change in status is perhaps just kind of a more gradual but worsening instead of getting better. Again, unfortunately, it can be part of the clinical situation that that patient is in. However, it can also be related to medical errors. So again, I'm not saying that this means that a medical error has occurred, just a point to look out for, particularly if the decline in the patient has happened after some sort of a surgery or procedure. That could be indicative that perhaps something went a little awry in the OR that either we didn't catch, or unfortunately, sometimes things happen that the care team is aware of that hasn't been disclosed to the patient and family. So again, just another situation to gently ask questions, not accuse, though. Unusual medications. Again, during a hospitalization, you are going to expect that the patient's going to be on some medications that they are not typically on when they're at home. Something has changed with their condition, whether it be an illness or a flare-up or an injury of some sort that warrants medical treatment that they do not typically need. However, if something has suddenly changed with the patient and there's medications that they haven't been getting through the hospital stay, and nobody's talked to you about this. Again, that's a good point to pause, ask questions, and dig a little deeper. A red flag for me is any staff that won't answer questions or just seems to be very dodgy around a topic. If things are operating the way that they are supposed to be, then I can't see any reason why any member of the care team would not be willing and able to answer your questions. Typically, and this goes beyond, of course, just healthcare. If somebody's not going to answer questions, it's because they're hiding something. Again, not always. There can always be another reason. But that one is a big red flag for me that I have encountered before. And then the last thing to be on the lookout for when looking for medical errors is unexplained medical equipment. Again, this can go along with the decline. Sometimes, unfortunately, that is part of the patient status, but a good time to ask questions. And again, these things should be explained to you. Lastly, the biggest thing you can do for yourself or your loved one is advocating for your loved one's wishes. It is very difficult to self-advocate when you're feeling ill. I think about even just having a cold, how crummy you feel. And I know when I'm feeling sick, or goodness, I went through hyperemesis gravidum with this pregnancy, I couldn't argue with my toddler for anything. He got peanut butter and jelly for dinner, I think like 4 days in a row at one point. And that was something that wasn't severe enough to land me in the hospital. So certainly when you are in the hospital, it can be very difficult to be vigilant in looking for all of these things and asking the right questions. And then also in return, advocating for yourself, for your needs, wants, desires, and getting the care that is appropriate for you. I always encourage to have, again, a friend or family member at the bedside, even if it's not the same person there constantly, to have somebody in the room with you who can speak up for you, if the doctor is using those acronyms, or again, if they're seeing any of this strange medical equipment or a provider that is acting a bit dodgy. It's really best to have someone there for you who can speak on your behalf. This is exactly why independent patient advocacy exists, because not only not only are we there working for you to advocate on your behalf, but we also have the clinical experience, if you hire a clinical advocate, I should say, to already know exactly what to be on the lookout for, as opposed to casting a wide net and, maybe it's not something, maybe it is something. We've got the nose for it, and we can look out for you and speak up on your behalf, and have that skill and that experience of how to communicate with the staff, who to ask the right questions to in a way that isn't going to be frustrating or annoying. We can speak the language and get to the end result very quickly. So I always recommend you have somebody with you on your behalf. I hope that these tips were helpful for you. I know that was a lot of information. I'm really glad that I broke it up into 2 parts. Perhaps I could have broken it up into 3. I will keep that in mind moving forward. Let me know if you would have preferred this to be shorter, if you felt it was at a good length, if it was helpful for you. If you or a loved one are struggling with a hospitalization, or know you've had these kind of issues in the past and are interested in a little bit more support for future hospitalizations, please reach out to me and I can let you know our options for kind of making that happen so you have a better healthcare experience. I look forward to talking to you guys next Monday, and take care.